We know there's a lot of evidence mounting around oral health and how that improves the physical health and overall health of individuals. But the challenge is getting that information out, sharing that information, and having folks realize that that kind of work is critical to improve the health of the population.
Some of the challenges we face integrating oral health and behavioral health and physical health are that they come from very different systems historically. And getting clinicians and the operational workflows all in alignment to bring in various disciplines that have not historically been part of their practice can be challenging.
In 2017, CareOregon Dental gave $2 million in grants to 5 organizations planning projects that integrate oral health with physical and behavioral health. These programs will improve our community's ability to get the total care they need.
We wanted to work really collaboratively with our FQHC partners to test and learn some opportunities to integrate oral health into either behavioral health or physical health. And so we worked with the FQs to really help them figure out what areas were important to them and how could we provide funding, technical assistance, support to help them implement some type of oral health integration work.
Virginia Garcia added a dental hygienist to their women's clinic. Now when children and pregnant members see the doctor, they can get dental care too.
What we're trying to do with the support of CareOregon is to get the processes of seeing patients in the dental clinic and seeing patients in the medical clinic, and both leveraging the access to the patients for quality of care initiatives and then referring patients back and forth across this divide that's been present for years and years, trying to break that down and leverage each other's contact with the patients.
Pregnancy really is a time where patients are really motivated to make changes for the better. When you affect mothers, you in turn also affect their children, because if they place value in oral health, for example, then they're going to also model that for their kids. So by improving the mom's health, you're also improving their children's health, and that is just all around good for the community. I feel I'm fully integrated into the medical team. I would say that I've seen about 82% of the women that are seen here. So we're capturing most women that come for prenatal care here.
Clackamas County Health Centers started offering trauma-informed care at their dental clinics. This works to lower patient anxiety and improve members' experience of seeing the dentist.
As our patients come to see us, often the first thing they say is they hate the dentist. They wouldn't be here if they didn't have pain. And we want to turn that around.
So looking at ways to support the dental team to be able to be more equipped to manage anxiety in patients, resistance, sometimes even anger, agitation, or aggression in health clinics are really associated with fear, anxiety, and a past history of trauma.
When someone has an opportunity to express what it is that they're actually having anxiety around, it actually calms them immensely.
To find someone that really hears what you're saying and connects is like a miracle practically. And they do that. I didn't say I was stressed out, they saw I was stressed out. On a scale of 1 to 10, my comfort scale used to be probably a sub 10. Usually I'm in the chair and my body just starts sweating. And this time I used my stress ball. My body didn't sweat, my heart rate didn't go up. Like it was, I can't say relaxing, the dentist is never relaxing, but it was as relaxing as it could possibly be. It was really not much stress at all.
I think our trauma-informed care is very transformational. It connects us on a human level to our patients. They are not just a tooth, they are not just a cavity or a filling. I think it's just the beginning of the conversation we all need to have about whole body care.
NARA now offers dental services at their residential treatment center so members can take care of their oral health without leaving the center.
Some of these people have never seen a dentist, or if they've ever seen a dentist, it was not under the greatest circumstances. They were already in pain. And then a lot of them have trauma that's left, a generational trauma, historical trauma.
And they especially need our help because they've been forgotten in so many ways. So we've been able to see them when some of them are at their greatest need.
When you look at the different health disciplines, such as oral health, physical health, mental health, addictions, we view those as all connections to that holistic healthcare. And to make the person have a better life and a more productive life, you have to look at all those and how they're connected. And so
we've had people come to us and say, I wouldn't even go to the dentist before, but now I'm here and I feel so confident about my smile that I was able to go out and get a job.
There's a handful of clients, like I said, that wouldn't have ever gotten dental services and potentially would have left treatment. But because they were able to get services through this project on site, have completed their treatment and are doing very well.
I think that this is just a drop in the bucket as to what we can do with our services. And I don't see this going away, and I see us expanding on this model even further.
Now, parents who bring their children to Dental Baby Day clinics at the Multnomah County Health Department can also get their kids' vaccines up to date.
Whenever you're able to provide more services that really impact a child's whole health in one visit, I think that's a huge benefit to our clients, not just in terms of their time, but letting them know that we're really not just focused on their mouth, we're focused on their whole child's well-being. And that's what this program's really doing.
Between the ages of newborn to 3 years old, there are a lot of appointments, a lot of vaccines that are due, and it is easy to fall behind. So a program like this is kind of a relief for parents. It's like, oh, I forgot to do this. Great, I can do it at the dental appointment.
I brought my older son here for vaccinations during his dentist appointment, and it's been really easy. And today I got my youngest son vaccinated during his dentist appointment.
The whole appointment took 10 minutes, and that includes the vaccines, paperwork, questions, and signing up for my chart.
I enjoy getting to do this type of work. It's new, it's innovative, it's having to connect people who haven't been connected before, and I get really excited about that. I think this is us looking at the bigger picture and moving in the direction that we need to be going, and getting to be a part of that is exciting and something I value and enjoy.
Kids from newborn up to age 5 can receive dental care and occupational therapy alongside doctor visits at the neighborhood health center.
The P2 Path is a program for our youngest kiddos, our 0 to 5 kiddos and their families, and it's designed to support the primary care team with both screening of our children for high risk or needy areas, and then providing intervention for families embedded within the visit.
We have a pathway that we've created for children to receive total comprehensive care, and in a pretty big way it's trying to unsilo these different aspects of medicine and really combine all of what a patient needs into one location.
We're really thinking about skill building, so rather than just connecting people with resources, my emphasis is on how do we build capacity and build skill now so that these children have the ability to keep themselves healthy in the future. But I'd say the bigger measure of success are just in the families that I've worked with, where they've gotten into services that they desperately needed, or they are making gains that they haven't been able to make for maybe months because either nobody had identified that there was a need or they just didn't even know where to start. So for me, that feels like a bigger measure of success when I hear from families that they are doing better and that a child is thriving where otherwise maybe they were struggling.
Together, CareOregon and our partners offer integrated health services that make an impact throughout our communities.
OHIP is working better than I think we could have planned for. It created an opportunity for us to meet with our clinic partner systems who have physical health and oral health and behavioral health in their clinics. But we were able to meet with the highest level of leadership in the organization and share with them what our views on integration of care and what oral health importance is, and for them to be able to share what that is from their perspective and together align. And how are we going to really do this integration in a way that improves the health of the population?
I hope that we'll move into a phase where we not only support them continuing to learn and develop in whatever project they've been working on individually, but that they also start to work collaboratively across programs to bring in new components to their health centers.
At some point, the mouth became separated from the entire body. And I'm excited to move forward and put the head back on the body and focus on the entire person.
Innovation through oral health integration improves the health of individuals and the community. That's the CareOregon effect.